The bad behavior of your pet. A lot of people think their pet is just being badly behaved. But that's not always the case. A dog that suddenly starts growling. A cat that stops using the litter box. Uncontrollable barking. Scratching furniture all day long. Unexpected aggression. Severe anxiety. All of this can hide something much more serious. Pain. Neurological disease. Hormonal changes. Internal problems the owner simply can't see. And the worst part is that many animals suffer for months before getting help. Because the behavior is treated like stubbornness, not a cry for help. A calm dog can become aggressive when dealing with chronic pain. A loving cat may start hiding because of hyperthyroidism. A pet that won't stop barking could be living with anxiety caused by physical changes in the body. Behavior changes when the body is suffering. One of the most common mistakes is looking only for a trainer before investigating the pet's health. Of course, trainers help a lot, but some behaviors don't start in the mind. They start in the body. Imagine a dog with joint pain. Every time someone tries to touch him, he growls. The owner thinks he became aggressive. But the truth is different. He's just trying to avoid more pain. This happens a lot with older dogs. Arthritis, for example, causes constant suffering. And many animals express that through behavior. Another common case involves neurological diseases. Some pets start walking in circles. They become disoriented. They bark at walls. They seem strange. At first, many people think it's funny. But this can indicate brain changes, neurological episodes, or even cognitive problems linked to aging. In cats, hyperthyroidism is one of the biggest causes of sudden behavioral changes. The animal becomes more restless. Excessive meowing appears. Appetite increases. Weight drops quickly. Some become aggressive or extremely anxious. Many owners think the cat just became more energetic. But the body is actually speeding up in a dangerous way. In dogs, hypothyroidism also deserves attention. In this case, the animal usually becomes more tired, less interested in playing. They may gain weight easily. Some develop anxiety, sadness, or mood swings. The owner thinks the dog is lazy, but there's a hormonal imbalance affecting everything. There's also silent pain. It's one of the hardest things to notice. The pet keeps eating, keeps walking, but changes small habits, avoids jumping on the couch, sleeps more isolated, doesn't like being touched in certain areas, gets irritated for no clear reason. These details matter a lot. Veterinarians report impressive cases. One involved a dog that attacked anyone trying to put a leash on him. The family believed he had serious behavioral problems. After testing, they discovered a severe cervical spine injury. Any handling caused intense pain. After proper treatment, the aggressive behavior almost disappeared. Another case involved a cat that urinated all over the house. The owner considered giving the cat away because they thought it was acting out. But exams revealed a painful urinary disease. After treatment, the behavior improved. Your pet is not always being disobedient. Sometimes they're suffering. That's why every owner should know about behavioral red flags. These are warning signs that indicate an urgent need for veterinary evaluation. Checklist of dangerous signs. Sudden personality changes. Unexpected aggression. Excessive barking or meowing without a clear reason. Walking in circles. Disorientation. Tremors. Obsessive licking in one area of the body. Sudden isolation. Extreme fear. Loss of appetite associated with behavior changes. Sleep changes. Stopping the use of the litter box or the proper place. Crying when touched. Crying when touched. Extreme anxiety that appeared out of nowhere. These signs should never be ignored. Another common mistake is trying to fix everything with scolding. The pet is already uncomfortable, already scared, and then gets punished. That increases stress and makes the situation worse. The right path almost always starts with medical investigation, clinical exams, physical evaluation, hormonal testing, neurological evaluation when necessary. After that, if the veterinarian rules out health problems, then a trainer or behavior specialist becomes an important part of the process. Health and behavior go hand in hand. Animals can't explain what they feel with words, so they speak through their actions. A bark may be anxiety, a scratch may be stress, a bite may be pain, and noticing this early can save your pet's quality of life. Because sometimes the bad behavior was simply a silent cry for help.